This is Dr. Hema Divakar, and on behalf of the IHW Council, we invite you to yet another thought-provoking discussion with very distinguished experts on board at today's deliberations, with the title of Protecting Women's Health by Preserving the Uterus. Well, Save the Uterus is the tagline, and then most of you would have heard save tigers, save mothers, save babies, save electricity, save water. What is it that we are going to talk about today on saving the uterus? Well, you'll hear from the experts here. We will be shortly joined by Bindu Gopinath, who is the Additional Director of Directorate of Women and Child Development, Government of Kerala. By the way, this is the special Kerala edition brought to you by the mayors. The other distinguished speakers on board are Early Matthew, who is a program manager at the Kerala State Women's Development Corporation, Dr. Manoj Thomas, senior consultant and obstetrician gynecologist at the Government Women and Children's Hospital at Thiruvananthapuram, Dr. Ashwath Kumar R. We begin with a congratulations to him for having occupied the prestigious position of the president of the Kerala Federation of Obstetricians and Gynecologists, Dr. Lalitambika Karunakaran, who is the president of the LFB Obstetric and Gynecological Societies of FOXY, and last but not the least, who has put us all together, Deepak Chopra, who is a business unit head of women's healthcare at the Bayer Zydus Pharma. So my colleagues who are OBGYNs, that is Ashwath, Manoj, and Lalitambika, I'll be quizzing them next after finding out the perspective of what does the women and child development in the state of Kerala think about the situation of women's health in general. So my first question is to Early Matthew. The programs for women through your organization, which is probably mandated to do some programs, you program manager. What are the initiatives taken by the Kerala State Women's Development Corporation, and how is the response from the women themselves to your initiative?
Very good evening to all of you. First of all, I would like to thank you for giving me the opportunity, for giving our organization this opportunity, this special opportunity to participate in this discussion. So I am not a person from the medical field, but our organization is clearly, like Dr. Hema has already said, our organization exclusively works for the welfare of women and young girls. So we have a number of programs, like from empowerment schemes to social empowerment scheme for women and young girls. So related to this topic, I would like to highlight about our SHEPAD program, which most of you have already, doctors across Kerala would have sometime come across this program. It is a program which is being done exclusively for the benefit of young girls, students of government-aided schools across Kerala. So we are in tie-up with the panchayats, the local body system, in ensuring that this project is implemented at the grassroots level. So what happens is we in working with initially when this project was conceived, we held multiple level discussions with the health authorities of the state. So to find out what is the exact need there, what is the exact gap over there. So what we realized is there is a need for holistic approach when it comes to implementing a menstrual hygiene management program. So that is how we started. Initially, we thought it was just about distributing sanitary napkins, but then we got to know that it is not about just delivering quality sanitary napkins to the girl students, but also ensuring that they are menstrual, they are able to adopt safe practices. So that happens only when they are provided the complete ecosystem for following proper menstrual hygiene. So, in addition to providing high quality sanitary napkins free of cost to the girl students, we are also ensuring the availability or installation of incinerators in the government aided schools, so that they can dispose the napkins in an eco-friendly manner. At the same time, we are also ensuring that there is a storage facility and almirah facility. Initially, we went with the vending machine concept. But then we realized that the vending machine concept has a lot of drawbacks. There is a cost involved in setting up an installation of vending machine, but as and when there is always a need for improving on the quality of the sanitary napkins, on the spec that is involved. So we make it a point to subject the pads being supplied to us to lab tests, and so as and when specifications change, we noted that the vending machines were becoming obsolete, and we were not able to use them properly.
So the Almara concept.
Yes, we shifted to the Almara concept. And there's another thought that went behind this thing. We appointed teacher coordinators or school counselors to be our project implementation partners at the school level. So each time a girl student comes and collects a sanitary napkin, she also gets an opportunity to speak to an adult person regarding her the menstrual hygiene, her practices, and if she's facing any issues. So that is one thing that we thought of doing, and so that's been happening. Other than this, as and when the sanitary napkins are supplied, we also provide menstrual hygiene awareness classes. So these are not just awareness classes where we provide education on reproductive health, menstrual hygiene, safe disposal. And besides this, we also provide training on gender sensitization, drug abuse, how to like sexual abuse and how to counter that. How to about POXO, the awareness of their rights as children. So all these concepts are involved in the menstrual hygiene classes.
Just if I may interrupt for a second, okay? I want to ask all my OBG colleagues here, from menstrual pads to menstrual cups, yes or no? Manoj is busy something. Yes. Okay. So we will pitch in this idea to your organization also very soon. Something which is cost effective, something which is hygienic, something which is environment friendly and long term. This will probably come to stay, because you also mentioned about the disposal. So the waste disposal, as we call it, this disposal of the menstrual pads and the accumulation of so many pads are also becoming a huge menace in the long run. So, yeah, so I think this point we need to add forward to see whether the newer innovative for the low middle income countries can be propagated in a stronger way, because all the OBGYNs have said yes, and you said you're not from the medical space, so if you want our expert advice, we'll give you more free of cost.
Okay, yeah. Ma'am, I would just like to add on that we are also distributing, doing the same kind of a similar kind of program for supply of menstrual cups to women. So when we were approaching, initially there is a taboo, like maybe such discussions have to come.
Sure.
Initially, now parents have they have a difficulty in when we tell them that we need to introduce alternatives to the sanitary napkin. Most parents are very skeptical.
Right.
Being 6 and a sensitive age at 6 to 12 standard, they're small kids in the eyes of their parents. So how can they use them?
And early in the journey through her ages, you mentioned catch them at the correct space to start inculcating some thoughts about uterus, menstruation, hygiene, life skills, women's health as they go along in their journey. Has your organization continued this endeavor beyond the school levels into her reproductive age and beyond? Because that is the key space for discussion today about saving the uterus. So can you just tell us what is the roadmap or the plan by the Women and Child Development Corporation, if I may ask.
Okay. Essentially, like I earlier added, we just have stepped into that space right now. So we're working again with the local body levels. They have a women component plan, and they are working with us for the introduction of the menstrual cups in the local body among women in the reproductive age at the local body level. So again, awareness is an important aspect for proper use of menstrual cups. What kind of, like the small or the medium or the large, what would suit them, how to select, how to make a choice. So those awareness classes are being given, and the ASHA workers are also collecting data, and we have received a couple of orders from districts like Kottayam and Wayanad, and a lot of other districts are coming.
Okay, forward. Beyond this, do you work with women aged 40 and above, where the question of uterus, saving the uterus, it's already finished its job, what do we do with it? What is the kind of work that you're putting in, or the attitudes that you perceive?
Okay, ma'am, I think essentially we are an organization, we are a state analyzing agency for national finance corporations. So our primary, most of our work is focused on financial empowerment. And this is a social empowerment aspect where we work with women on the providing safe and affordable stay for them. And our SHEPAD program is one such program. So definitely, depending on the inputs and discussions that we get at the state level, we are willing to come forward with new products.
Excellent. So this is a very good opening, because we have begun at the right time, but we have a long journey to go across the women's lifespan, and we call it the life course approach. So we do wish that even in future, this strong group and the members of the IHW and the professional organizations would join hands with you to move this movement further, to do more and to do better. One last comment before you leave early is about the education of girls and women in Kerala, known to be the best scoring in the country. Do you think their attitudes are a little different from the girls and women in the rest of the country? Or do you think they're forward looking? Or do you think conservatively they still have the same taboos? Or what is your first impression? Or do you have any data on that? Or you can just tell us how it is perceived?
Yeah, I don't have a data exactly, but our response from the students, as in when we meet them during the training programs, is very positive. They have a very broad outlook. Some of them are even willing to experiment with the menstrual cups, and some of them are even trying out with cloth pads, tampons. So I would say we are forward looking. That is the
super. Thank you so much. Thank you so much for participating in this wonderful discussion. I will be going to Ashwath. He wants to make a comment on what you have commented, but my question to you, Ashwath, is also, saving the uterus is the theme. And you know, and Lalitambika and Manoj also know that in our fraternity, when they come for second, third opinions, they've already had the first opinion that they should be removing their uterus. This is the right methodology of treatment, and therefore they're seeking the second opinion with you. And all that you notice is, oh, this is such a tiny problem. Oh, this doesn't really need a uterus removal. No, I can save her uterus. How often do you encounter these kind of situations? And even before you respond to this, I know that you wanted to cross-comment on what Matthew said. So please go ahead.
First, thank you for inviting me for this. It was my first panel discussion as the president of Kerala Federation of Obstetrics and Gynecology. So actually, I'm very happy that I met many people which I wanted to meet, especially program manager from the Kerala State Development Corporation also. So, madam, just one word, and then we will come back to the Save the Uterus about the menstrual hygiene. So, actually, the first thing, we have made a project actually to submit to government. It will be submitted. see, as correctly told, menstrual cup has been introduced. We wanted to increase the awareness among all age groups, not only the young. So we are submitting a project to government. So I get very happy that I can contact early we are
Can I request Early to mute, please? Early, can you mute yourself? Yeah, thank you. Yeah, Ashok, go ahead.
Okay, thank you. So what we have done is that project is like this, that we are going to educate. See, something is coming, popularizing. So before that, if you educate them to accept it, like see, HPV vaccine is coming. If you just introduce HPV vaccine, nobody is going to take. Many of them don't take. So to the awareness, increase the awareness all among Kerala in all age groups. Not only, as madam you correctly told, not only because when the cup was introduced, people were telling it was awareness among young like that. I wanted it to be because many of the when we discussed
right
with the
across,
patients, which we have to madam that early madam that many of the seniors who are using pads are not ready to change. They are telling that we are using pads, we are continuing with pads. Okay, so that is what I felt. So that is why anyway, government we are giving a project to government for education classes all around. So as the association, Kerala Federation of Obstetrics and Gynecology, all the doctors will help voluntarily take classes for the people all around Kerala. That is what. So we can work hand in hand. Anyway, I met her in this first time I'm meeting.
Excellent. Yeah, it'll be really a good campaign. Yes, because it will work both ways. You know, the younger girls motivating the elders and reverse also. So great.
That's why the elders motivated means their children, they naturally get motivated. That is why I felt okay.
Yes.
Then coming back to the main topic of discussion. Burning question. So as you correctly told,
half a centimeter fibroid. No complaints at all. Patient is like happy. But as usual, she's got a routine scan done.
See, basically, I get a lot of these cases because I am basically a laparoscopic surgeon, known a laparoscopic surgeon for years in Thrissur. So what happens is that patients have been referred to me, see, for hysterectomy. They have been, reference letter is written for hysterectomy. It is written to by one of our colleagues only. So it is very difficult to counsel something we are counseling against it. It should not feel bad to the colleague who is sending it. Okay. So it's a very sensitive issue so our government is doing a good number of work actually for, but the thing is that they have to work in, because the government hospitals, whatever we do in Kerala, most of the work is done in the private hospitals. Only 60 to 70% of hysterectomies, everything is done in a private sector. So even if you strengthen the government hospitals, and that part is not enough. Actually, we have to sensitize the public. Okay, two things. First, we have to sensitize the doctors, and we have to sensitize the public. Okay, sensitizing the doctors means you have to have CMEs or classes for them. It's easy actually. Sensitizing the public means public should know that doctors, most of them knows. We have to only insist things to them. That means you have to be a little cautious on doing hysterectomy, take other. But the public, many of them doesn't know. They come to us and ask that to remove the uterus.
Yeah.
So many of the doctors, what they do is that they don't explain anything to them. Oh, you have come to remove the uterus, give pre-op investigations, evening, post the patient for hysterectomy. That is what we've done.
Let's do it.
Just do it. Oh, anyway, you have asked for something. You are coming and asking for something. It's easy to convince that and do it than telling the other way. See, uterus is an organ which has to be there. You have so many benefits out of it, not only the childbirth. And all these things have to be explained, and then tell them all the alternatives. You have drugs, you have LNG, IUCDs, you have so many things you have. It has to be explained to them. So what we are doing as a president, what I am doing is that I am having in each district, I cannot do the whole district. Each district I have taken certain areas and doing pilot programs in these areas. We are starting in April itself in a pilot program in a place called Selakara. So where all the people will be called, and we are doing so many things actually to attract people there, camps, so many cancer screen, because otherwise don't come. You say that we have a lecture on alternatives to hysterectomy, nobody will come. So we have tried our best. so that the patients will, people will come. So we conduct awareness. This is hand in hand with the government, what we are doing. I met the minister, hand in hand with the government, we are going to do this program.
I think, Ashwath, this input is really, really very important because you are generating a demand for saving the uterus, because you are empowering the women themselves to know that there are alternatives. So even if a colleague writes out a note for removal of a uterus, maybe she will ask a question to the colleague himself or herself that, is there any alternative, doctor? I've heard of this, that, and the other. Oh, this camp was there, this campaign was there, but I was told something else. Can I take that option? And that may be a softer way of getting the track on saving the uterus, rather than you cutting. They say, oh, we sent to Ashwath because he's an excellent laparoscopic surgeon, but look at him, he's telling save the uterus, and he sent back the patient for use. Yeah, so that can happen sometimes in practice, and that is indeed a sensitive issue. So your efforts at generating the awareness and the demand from the patient to save their uterus is also so very worthwhile. Anything else you wanted to add on this?
I want to comment on that audit part of it. It's very important. See, accountability anywhere is a must. Okay, accountability, you have to be accountable to whatever you do and all these things. So whenever it was told, see, we are having hysterectomy and cesarean audits we are having in Kerala. So I asked many people, there's a question, same question to many senior doctors and everybody, that is a hysterectomy audit necessary? Okay. So this was the question that was asked. So many of them, I found, from the majority told that they are not telling that accountability should be there. To have a forced audit, they are not preferring. Okay. So what they say is that they should be reviews, like we have in maternal mortality, like confidential reviews.
Sure.
There should be reviews, review committees, and it can be easily reviewed. Instead of confidentially, it can be reviewed. And in one hospital, the hysterectomies are more, we can analyze it and we can confidentially talk to them. So instead of, when you force something, what is happening, people try to, even my friends all around India, I asked many people around the same question, why in your, what is your hysterectomy audit, is it very truthfully done? No. So many of them in North, many of them are telling that they see, when you fill a form, you are being forced to see, if you have not done it, done in excess, means you are something like you are penalized. When you hear the word audit, you feel little uncomfortable. That means you are not able to see, if you feel, if the cesarean rates in a hospital, government may ask question to you. So people who are not medical people can tell many things, because you are having a big hospital, and you are having a referral hospital.
Here I have two short questions for you, Ashwath. One is, you said 60% of the work is in private. So private is not mandated to furnish any kind of data. Yes? So they are just free to do whatever. So we don't even have the data of how many are doing what hysterectomy. So would you agree with that?
Yes, yes.
Yes. Secondly, as a president, do you want to influence your members to just put their numbers into a hysterectomy register?
See, I just want, say, as a president, I just want, the basic thing I thought was that I don't want to hurt their feelings. That is what, see, when I say that as a president, I say that audit, see, just not started in Kerala. So I say that I introduce audits, I introduce many of them, as the cesarean audit itself, they are all doing in Kerala, everything meticulously done. But everybody, see, cesarean done means immediately the paper is we write everything immediate. At that moment itself, we fill and give to the government, send it to all these things. But they are all uncomfortable with them. Maybe it is just a apprehension or whatever it is. So they don't, I discussed with many of them, seniors as well as juniors. In the last 2 days, I would have called everybody before answering this question came forward. So they say that we can have a confidential review, and it has to be, they all say that it has to be reviewed, because
that's fine. Because somewhere you have to begin. And so I think, I quite agree with you, because you can't suddenly bombard everybody maybe with, a must-do kind of, you can whip them around, and then they'll get into a more chaotic and a little more dangerous situation. So thank you so much for your excellent inputs. Now I go to Lalitambika before I go to Deepak and Manoj. Let me say, we are talking so much about sensitive uterus. So what if she knocks her uterus off at, she's finished her childbearing, be happy. So what is the great disadvantage of removing the uterus as against saving something which has no further use in your body?
Though we say that, am I audible?
Yes, very much.
Uterus is just for childbearing and menstrual function. We know that ovaries are very close to uterus and partly supplied by the uterine arteries. So if you remove ovaries at a younger age, it has got two aspects. One is the psychological aspect. After removing the uterus, many young women feel that they are incomplete and they feel that the sexual function is not proper. That is one aspect. Second aspect of removing the uterus at a younger age is that many women lose their ovarian function, premature ovarian failure within a few years of hysterectomy. So the consequences of premature ovarian failure are great. So it affects all the systems of the body, genitourinary system, even brain, can affect the cardiovascular system. So overall health of the women is impaired by a premature hysterectomy. So they can have hot flushes. Later on, studies, there are several reviews where they say wall prolapse is more, or genitourinary prolapse is more after hysterectomy than in women who have not undergone hysterectomy. And osteopenia and osteoporosis more in women who have undergone hysterectomy at a younger age. Depression. There are several studies reporting all these adverse effects after hysterectomy in a younger age. Then impact of hysterectomy on lower urinary tract is great. Many women have, though they don't report very frequently, if you go to them and ask them, many of them have genitourinary atrophy and symptoms related to genitourinary atrophy, like they think it is urinary tract infection, but it is just estrogen deficiency.
Right.
So many symptoms which they are going on, living with those symptoms without much. So doing hysterectomy at a younger age definitely has got several disadvantages. And there are some studies say there is slightly higher incidence of certain cancers like renal cell cancer, thyroid cancer, etc. in women who have undergone hysterectomy at a younger age. So it is not only the psychological effect, but also definitely removing uterus at a younger age impacts definite health disadvantages on these young women, which they are not complaining much, but they are coping with these problems.
Excellent. So there are a huge number of disadvantages of removing the uterus. There is also a myth that if you remove, then there is a sense of, loss of something. That is also one category of women. Very beautifully explained. Deepak ji, now so many technical things that Dr. Lalitambika has done in your campaign for saving the uterus. What does your mass awareness campaign involve? How do women understand what is important, what they should be actually doing? So what is the pitch and the taglines for your campaigns? And also, what is your sense of the impact that your campaign has made?
Right. So thank you so much, ma'am, for this question. And I would begin with, again, congratulating Dr. Aswath, good friend of mine, taking over as president for Kerala Obgyn Gynae Society. So yeah, so madam, as you rightly told, we started this campaign, Preserve the Uterus, last year. So we had this collaboration with the Federation and Obgyn Gynae Society of India, FOXY. So FOXY has been a very strong collaborator and partner with Bayer. Bayer being a global leader in women's healthcare, and we have a history of around more than 90 years now. So before the pandemic, this thought came that most of the governments, NGOs, and most of the agencies, they work towards maternal health, they work towards menstrual hygiene, they work towards other initiatives in the women's healthcare space. Right. But this was one area, and even you will agree, ma'am, many of the state governments are now kind of taking a lot of initiatives and reducing the cesarean section rates also. So this was one space we thought probably is very, very important where the rate of hysterectomies are going up year after year, and this is all in the public domain with the data shared by the National Health Family Surveys. And to that extent, that few of the provincial governments, state governments, the hysterectomy rates are as high as 25%. Yeah, and if you connect the dots, and if you see the root cause, around 46% of hysterectomies are done for heavy menstrual bleeding. And you all are experts sitting here, and heavy menstrual bleeding can have very minor root causes as well, where the the uterus can be absolutely preserved and safe. As Dr. Lalita was also mentioning about the short-term and the long-term negative impact post removing this uterus. So we thought, let us do something in public health area, which probably was not our domain, to be very honest, being a pharma company, being a commercial organization. But we thought, being a leader in women's healthcare space, this is our responsibility. That like we should initiate something. And honestly speaking, we started with with the title of Mission Save the Uterus before this pandemic started. And once the pandemic struck, so we had a lot of digital meetings. So we had three pillars in our mind. A, how do we educate the HCPs beyond tier 1 and tier 2 cities? Because tier 1 and tier 2, we know HCPs, thought leadership is already there. Even the society is also quite empowered in terms of knowledge, in terms of awareness. But
so for the lay public this meeting, HCP is healthcare provider. Anybody who provides for your health, anybody who is supposed to provide for your wellness is first sensitized that it is important to save the uterus. Go ahead, Deepa.
That's right, absolutely. And secondly, we thought, okay, like how do we, increase the education, awareness among the society? Because women being the pivot core of a society, core of a family, and if the women of the house suffers, the society at large suffers basically. And thirdly, we thought, how do we partner and collaborate with policymakers, state governments, and do something which can structure, give some kind of a shape and structure to public-private partnership, which was spoken earlier as well. Right. So these are three fundamental pillars where we thought we'll be doing it. And honestly speaking, we realized within a very short span of time after launching this that we as a pharma company definitely has some limitations. We can't go beyond the doctors, gynecologists, and the thought leadership. So how do we collaborate? How do we partner? Hence, we partnered with Foxy as our knowledge partner. We partnered with IHW as a very strategic partner. We have partnered with the Family Welfare Association of India to execute the actionables. Yeah. So, right. So this is how we have started now. And as far as the impact goes, we have already educated and trained around more than 5,000 gynecologists in using and understanding about the modern non-invasive ways of saving the uterus, which would avoid surgery. And this year we have a plan of having 70 medical colleges where we are planning to train all the postgraduate students, junior doctors, so on this cause and this mission. So this is how we are planning for further milestones. Yeah.
Excellent. This is it's a good combination with the Ashwath and the healthcare providers and the obstetric societies, professional organization, empowering the women to understand more about it. Whereas your organization is trying to build the capacity and sensitize the healthcare providers to do more and to do better. This brings me to a very key question to Manoj Thomas. Here is a patient, heavy bleeding, she's fed up, and she's in a remote village. She goes there and the doctor says, well, I can offer you a hysterectomy. That will be a one-stop, one-time solution to all your problems. Okay? Because he or she serving in that remote area doesn't know anything better, doesn't know the alternatives of treatment for HMP, it doesn't have the concept of LNG IUCD, for example, or other methodologies of conservative, what we call saving the uterus, but still you can solve a heavy menstrual bleeding problem. That type of thing, the concept is non-existent. But that doctor is fairly, ethical. He says, I don't know, but I can refer you to Dr. Manoj Thomas sitting in such and such a place. Okay. But the patient doesn't have access to your center. She just cannot afford it. She cannot go. So what is the thought process in your mind? First of all, we want to know the alternatives because there are a mixed variety of stakeholders who are attending this program. So if a woman says, no, my situation is pathetic, I really want a solution, instead of hysterectomy, that is removal of uterus, what alternatives can you offer to save her uterus? And how do you build a network and the cascade of levels of practitioners who can do their best for the women of this country? Manoj. Manoj, just please unmute Manoj. Manoj, yes.
Good evening, everybody. When a patient come with, this is a second opinion patient coming for, which was advised hysterectomy by some doctors in the periphery and came to me. I may cannot reject ask the patient that the peripheral doctor had done the bad thing. But we can say that there are other methods of modalities of treatment as medical treatment as NSAIDs, tranexamic acid, oral contraceptives, oral progesterones, hormone intrauterine devices as LNG devices, GnRH agonists, and also regarding conservative surgical procedures as hysteroscopic polypectomy, endometrial ablation.
Right.
Or say to her, we can convince her that we can avoid a hysterectomy in this case.
Right. So you will offer the alternatives and reassure her that, see, you have a problem. We are solving your problem, but we can save your uterus also. Yes. So that is the concept with which we are going. Now, again, my question deflected to Ashwath, that how you will train more and more people to do a quality-driven hysteroscopic polypectomy, for example, or any extra information of LNG IUD, the capacity building. Are you planning any e-certification courses, the skill transfer program? So more and more, not only in the Kerala Federation, national position, right? So how will you, what is your vision of scaling this up? So that everybody, almost will be an expert to do and offer alternatives.
What we are doing is that this year is that we are planning to have workshops. Workshops means in the morning there will be theory that is alternate. It's called alternatives to hysterectomy. See, that workshop itself is called alternatives to hysterectomy. And we are having a medical in the morning. All talks will be there. After lunch, we are going to have demonstrations. That means mannequin will be kept, and all the participants will be putting LNG IUCD. They will be trained LNG IUCD and make them very simple. It's very simple. It can be put in your OP itself. Then videos of hysteroscopy. We are planning also to have hysteroscopy workshops along with small. That's on a mannequin. That means they will be feeling that they are doing it's easy. They do, and even to that extent, TCRE also is not a bad choice. See, certain things are there to that extent, even to TCR. So hysteroscopic procedures, like Dr. Manoj was telling correctly, a small polyp, hardly takes, nowadays it's like a OP procedure. Now outpatient hysteroscopies have come. To that extent, that
so to help people understand, a polyp is like the sixth finger, something little extra projecting into your uterus which you want to save. So even if there's a small thorn in your feet which is hurting you so badly, the moment the thorn is removed, you can walk comfortably. In the same way, a small polyp inside your uterus, which with a telescope called hysteroscope can be seen and plucked out, and then you're fine. So that is what Dr. Ashwath is referring to. Yeah, go ahead. Yeah. So there is a huge plan to build the capacity, and people need to take home the message that 70 medical colleges is great, it's fine. the private practitioners, most of the patients in many places across the country spending out of their own pocket, and not only their access and affordability should improve, but all cadres of healthcare providers, right from counselors who will tell them the right messages, right from the peripheral doctors who will guide in an ethical way and be aware of the options, and actually the specialists who will be offering the options and giving. So all the three layers we will need jointly to collaborate and escalate. Manoj, are there any psychological problems as well if the uterus is just knocked off? There have been extra gone, but that should become like too upset.
Yes, madam, there are psychological problems with it. If when the uterus is taken, the women think that would and so that she may think that she is something only half woman. This may cause various psychological issues as depression, emotional instability, crying, spells, etc. This may make her go for depressive disorders like that.
So the impact can be huge. You know, one organ is removed, but it can have some impact on something happening in your head as well. So that is a point well taken. So anybody who at the drop of a hat demands a hysterectomy on their own, that anyone could say, Dr. I'm just, get this out of my system. We need them to understand that a lot of physical impact, which Dr. Lalita just said, and also the psychological impact will be there. Having said that, my question back to Dr. Lalitambika is that do some women, for religious reasons and like a taboo, they feel that, oh, this is becoming too much of a nuisance. Yes, you've offered some alternatives, but they care about menstruation is not stopping. Some little bleeding is happening here or there. It is disturbing. It's coming in the way of everything. So what do you think is the perceived attitude? Still, is there a taboo? Still, when you weigh the scale of, does the women really want to say, well, or she wants to just get rid of it? When you balance that, what do you think the present day women, with all the awareness programs that are being built in, what is their attitude towards this? Just please unmute, Lalitambika. Kindly unmute. Yeah.
Actually, when we talk to them regarding various options, we have to tell them minor side effects also. So many women who want to go to temple regularly, who want to do niskaram, all they will say, will that be a hindrance to my religious this thing? Then we can convince them that is nothing related to these little bit sporting and all is actually not menstruation. You can abstain from going to temple only during the real menstruation. These things you can ignore and you can accept conservative. That I think many of my patients accept.
I agree. Yeah.
Every OP I get 1 or 2 patients referred for hysterectomy. When I talk to them regarding these alternative options, majority of them accept. Very few don't accept. Majority.
Excellent.
But you have to teach even adolescents, starting from adolescents and young women, you have to start them talking about these things. Only when they confront a major episode of bleeding or a dysmenorrhea, they are offered a one-time cure, they will readily go for that. But if they are already aware that there are so many options, then they will think of various options and they will be more accepting our advice regarding various options if they are really aware of. So
Excellent.
Awareness is the most important, and these taboos also we can tackle in a proper counseling. We can tackle. Many of my patients have accepted, Marina, with sporting they have accepted that this is not menstruation. They can do everything. Even with this sporting, they will abstain from going to temple and mosque and all those things only when they have the real menstruation. It depends on the way you counsel them.
Excellent. So it is there is a round of proper counseling, and they will be amenable to accepting the alternatives. And if the Kerala Society collaborates with Early Matthew and the group, when they are doing the menstruation and hygiene programs in the schools, they can build over it, at least telling them how important the uterus is even after the childbearing age, and what are the implications of having it unnecessarily removed off their body. So they have to learn to respect their own uterus in a way, which is a good idea to see in when in the adolescent age group. Now, Deepaji, coming to your third pillar of attack for policy with the government, how can you help Foxy and other professional organizations, other stakeholders, join hands and strengthen the policy for menopausal women? Because as of now, the reproductive child health care policy, good. After that, they are lost in the population. And the rest of our age, there is no existing policy for long-term care of the women in this country. So what is the thought process of yourself and the company and the white paper, and how we are going to join hands to really push for something which is high time that we push, because millions of menopausal, perimenopausal women out there will need a policy in place for them to avail of what can be the best for them. Deepak?
Absolutely, ma'am. Yeah, absolutely. You're bang on, ma'am. When we speak to policymakers, experts in the governments, everybody realizes that this is a major issue actually in each and every state of the country actually. And they also agree that it needs to be addressed. And as you rightly told, yes, there is no policy or there is no guideline as such. So that was the reason, we partnered with, of course, Foxy, because that gives us a very strong, credible platform to at least try and address this whole issues. So we had in 2022 we had almost 5 state summits. Yeah, so we kind of selected few states, including Kerala now for this summit what we are talking about, including Maharashtra, UP, and couple of other states, where the rate of hysterectomies was comparatively higher to the national average. Kerala, fortunately, I think it is quite good, quite low. Yeah, and as Dr. Ashwat was also mentioning, so we all realize, all the stakeholders realize that it is more in private sector compared to the government sector. But there is still no guidelines. What is the screening? When a patient has to be, nominated for hysterectomies, or maybe opted for an alternate therapy. And secondly, as Dr. Ashwat again was mentioning about, accountability. Yeah, so how, and the major reason in many of the states, especially in the eastern part and the northern part of the country, is general surgeons conducting this hysterectomies. Yeah, even the patient doesn't go to a gynecologist for an opinion, not even second opinion. And so that was the reason I was talking about HCPs at large, involving IMAs, where you actually impart awareness. And this year, ma'am, we plan to have 6 regional summits involving all the stakeholders, including the policymakers, and then having a consensus paper. So this consensus paper will, at least you will have something to pitch for. And on top of that, we have kind of shortlisted few states. To begin with, it is Maharashtra and Andhra, where we are donating Mirena, our brand, in medical colleges free of cost for the doctors for themselves to use it, evaluate it, generate data, and hence we will be able to compare it that a non-invasive method can be a big relief to the healthcare burden, and it supports the health economics as such. Yeah. So this will be something credible generated in the country by our own doctors and thought leaders, so that we are able to convince the thought leadership and also the stakeholders in
Excellent point.
Yeah.
Excellent point. Well taken. But we would also want to help Foxy and our organizations to move forward with aggressive data collection, because when we go in and pitch for a policy, they will ask for us for data on the table. Many times it is patchy, and then we say, we don't know what women want, we don't know what the doctors are doing, we are this, we are that. And they say, okay, guys, sort your confusion and come back again. That's how many times it is installed. So we have to work towards with a uniform voice with some concrete data on the table. And I'm sure all our leaders here will be very willing to collect the data from the patients as well. She's been given these alternatives, which does she prefer? That also adds strength to what we are asking the government to do, and also the comparative, the data with the hysterectomy done, what is the post hysterectomy implications, well, compared to the conservative methods where she has saved the uterus. This comes to the last round of questions where I want to ask Ashwath at the start. Thank you, Deepa. Ashwath at the start that see, now you're leaving the uterus behind. Let's hope, let's dream of a thing where only necessary hysterectomies are done and they're done at the right age. So everybody has the uterus in place. Not the uterus, the cervix, the tubes, everything is there. Okay. But the patient is not at all coming to you for any kind of further checkups ever in her life. How you will tackle that? Because the wellness across ages, the pathetic situation of HPV testing and pap smear in our country, for example, then the wellness of the routine annual checkup and the care that she needs to have, she's again at a disadvantageous position if she is not supported for a long-term follow-up with the uterus in place. What are your thoughts on that, Ashwath?
Madam, there is something situation different from other states and Kerala. See, Kerala, the literacy, as you know, that it's almost everybody is literate.
Yes.
And it's not, Kerala has achieved almost all. The government has done so much activities that almost SDG goals, everything to some extent we have achieved everything.
Fulfilled, yeah.
So the government policies in Kerala are strong. Due to literacy, people are accepting it. Okay. So here the problem comes is that, see, if you are doing hysterectomy, but as you correctly told, you are not giving proper advice to when to come, when to follow up, when to. So the hysterectomy is, patient also thinks that doing hysterectomy, everything is over. Okay, I am fine, my bleeding has stopped, but she doesn't know what are the complications. We don't explain to them, see, how frequently you have to come, what are the problems I can have after this. If you have done a hysterectomy also, you have to counsel them.
Both, even if you say the uterus, she has to come.
So it's something, so it is, so they should understand that just doing a hysterectomy, you are not running away from everything. You have to get followed up. So it's the same thing. You are keeping the uterus, giving medicines, putting LNG, IUCDs, whatever it is, she has to come. If you remove the uterus also, they have to come. So if they understand that, then only this we can start. Okay, you remove the uterus. Okay, HRT at proper time. You have to start, and then only the psychosocial problems, all these things starts. That are all very important actually.
Yes.
She will go for menopause early if you are keeping the ovary also. So all these things has to be highlighted to them. Then they come back to, like as you told, then we come back to original situation that they will say that, okay, let the uterus be there. If you have some alternative, let it. And one more thing is that in Kerala, it may be, I don't know, the policy makers are here. I wanted to make 2 points about it.
Sure.
I inquired the government because I had time to do some homework actually. So I just called government hospital doctors. I called private hospital doctors and I asked, what are your problems? Okay, so tomorrow I got Bindu and maybe people like from the government will be there. I thought maybe they will be here.
We can still convey it to them. No issues. Yeah.
Okay, it will be conveyed to them. The thing is that 2 things which I got the feedback is that, one, they are telling that the number of to counseling, all these things are not possible because the staff number is less. See, in government hospitals, bulk is there. Proper number of doctors are not posted because they told me to raise this and tell that. So unless you have enough staff, not only doctors, counselors, everything enough is there, they can work. Not that it is a OP, one doctor sitting, 100 patients are waiting. It's not possible to explain to them each. So one thing they asked was the staff.
That is the first ask. Okay, where I want to interrupt for a second to tell again, skill council is wanting to train the school and college dropouts in the entire country, who are 28 million in number every single year. These many human resources available. So we can definitely create wellness ambassadors or the healthcare counselors after, co-creating training programs for the community workers and the lay people who can be planted as counselors in these busy setups, and even in the private practice, if they can even come on rotation, it'll be a good thing. Excellent. Ashwath, next ask.
Second point, what they were telling is that the financial aid. They were telling that the financial, see, all needs financial aid to do all many things. The government many times tells policies, but the financial aids are late. Okay, they told that, simple, they told. They have ordered for an ultrasound, okay. Or their ultrasound has become damaged. They want to get it repaired. Things are, you tell it now, the ultrasound, they get it after 2 years. So, so certain things, small things, which will be needed, like correctly you have told, a hysteroscope. So many things are not there in a government hospital. Okay,
Right.
So their only alternative, easy method many times is a hysterectomy. That is what they are telling. So, so LNG IUS is costly. It's not. They don't get it for free. So if the government is providing them, it's okay. Then all these things has to. So two things I wanted to highlight, and everybody, doctors, the common feeling of the government doctors, what I am telling here is that two things there. One is the staff, and Dr. Manoj will be agreeing to what I will tell. And the two is the financial aid or the infrastructure development that has to be there. Dr. Manoj will be, he is from the government. He is from.
Excellent. So I will quiz him next, but thank you so much, Ashwath, because I really appreciate that you took the efforts to actually get the feedback, because sometimes the perception and the blame game is like huge, but we really don't know internal concerns within the setting, which where their hands are tied and they feel, okay, if we want to do good for the patient, maybe this is the best alternative that we have at the moment. Manoj, your response to the ground realities in a busy government setting.
Dr. Ashwin has said the staff pattern is years back staff pattern, so that the workload cannot be managed by the present staff. That it is gradually increasing, and it will. We hope that it will improve in time, but it may take some time.
Yeah. So that is you agree with that? That is a plug-in. And again, one more idea to Deepa, that in local languages, if you can come out with a 30-second message, animations, some video bites, etc., which can be widely circulated on the social media platform, it's automatically, what the counselor would have told, perhaps is also going to the public at large in a seamless fashion. For that, you need to curate that and co-create that messaging without any confusion, with the leadership from within Foxy and other organizations who can collaborate on this. And then it's the key element is translating it at least into 8 different Indian languages so that women out there understand. So there is a human resource constraint. The Skill Sector Council is ready to certify them as certified counselors for women's wellness. So if we could all get our act together and get that saying, and it's not one vertical of the uterus that they will speak about, like Lalita ma'am said, right from the menstruation, hygiene, we have to connect it to the long term. So we may kind of come up with a simple module which will take them through the journey. The present president of Rishikesh has already had a 15-minute animation on what all things can happen from womb to tomb for a girl and a woman as she grows. So something on the similar lines. We need to empower these counselors who are available in plenty, and they can do it as a part-time, additional job as well. The skill which we impart should be really important. One last comment from Dr. Lalita Ambika as to what do you think would be the way forward for the next generation OBGYNs, which I'm sure in your opinion also you would have recognized that they want to excel in laparoscopic skills, for example. So case is available, you want to go and try to do the drastic laparoscopic assisted hysterectomy, for example. And many of the corporate hospitals, because we are talking about the government, which Manoj is telling, that's a different ground reality, but we know that may not be in Kerala, but in many other states, that there's also a demand to generate more surgical cases. That so this also happens all the time. They say, "Oh, you don't want to do a hysterectomy, you just want to pay the Mirena." Come on. So what is your take on that?
Actually, I didn't get what you wanted me to.
I want to say that the next generation may think not of these broad canvas, mature way, the saving the uterus, they would want to use the laparoscopic skills to remove the uterus.
Okay, so actually from undergraduate career days onwards, we have to teach the students regarding management of menstrual problems, should give more emphasis on conservative management. So the undergraduates should get an impact. And then during the postgraduation also, seniors should be doing the right thing. They should be avoiding unnecessary hysterectomies, and they should be giving more importance to conserving the uterus, especially in young women for benign conditions. So these things will get imparted to these young, because I've been working in a medical college for 35 years. Now I retired, and so private and medical college both I know. So what you teach your postgraduates, they will definitely practice. If they see I am doing lap hysterectomy for a 3 centimeter fibroid, asymptomatic, they will also do. Whereas if they see that I am counseling them, I am not doing it, not even Marina for a subservious 3 centimeter, because so many people come with ultrasound report. Instantly detected fibroid. Somebody told me it's a tumor you had. So what I counsel the patients, what I do for those patients, my students are saying, and that will be imprinted to their mind. So if seniors teach them properly, tell them, counsel the patients properly and manage accordingly, rather than doing. I have seen many people doing lap hysterectomy just for doing the sake of lap. They will tell, I want to start with small uterus.
Thank you for your honest response, because this is what we noted. That's why the question which you made me ask 2 times.
I didn't understand what you meant. So they will tell, I will start doing with small uterus, but there it's only their interest of doing. They don't really think whether it is an indicated hysterectomy or not. So that is one situation where unnecessary hysterectomies are done, laparoscopic hysterectomy. So if senior teachers teach the students, I think, and also patients should be given all the options. They should be allowed to select.
I totally 100% agree with the role model kind of impact that Lalita was talking about, because that is really inspiring for them to value the ethical practice, and that is how the next generation should be groomed. I want last comments from Deepak as to what are your takeaways from the discussions that we have had, apart from getting the 6 core meetings together with the government for moving ahead with a consensus statement and trying to get policy in place, trying to escalate the awareness programs, trying to sensitize the CPs, as you said, and 70 medical colleges into the training. Have I captured it all, or is there more to come?
Yes, ma'am. These are the small milestones what we have planned for this year, as so we are developing this program as we are moving ahead, learning and kind of co-creating with our strategic partners, including Foxy. And as you mentioned, already we have a lot of patient education material in vernacular languages. Since this is a Kerala state summit, so we're talking about. So we do have in Malayalam also, so which helps. And again, this year, so I got a very good idea when you told about people who are on sabbatical or dropouts, how we can rope in these people, because counseling becomes the most important piece in especially in a practice of obs and gynec, more than doctors who are treating NCDs. I think
because we are roaming what is called Arogya Sakhis or Swasthya Sakhis, so for wellness. So I think we should take that program in a strong way ahead to plug in that gap. Go ahead, Deepak.
Correct. So this year, again, additional one thing what we have done is we have roping in Anganwadi workers also. So all these 6 states where we'll be doing this regional summits. So Anganwadi will be also invited, even though it is not for our brand Marina per se, but it is for the awareness. As ma'am was telling, the patient should be also empowered so that when they come to the doctor or their gynecologist, they should be aware of there's something which can preserve their uterus. And if there is something, what is that exactly? And like Dr. Lalita was also mentioning, the patient has to be given all options. So probably I think, so these small milestones would add up to the whole, and it will give a lot of big shape and structure to the whole initiative as such.
Excellent. So in the closing, before thanking all our distinguished speakers, I would like to tell everybody watching this program that have it really high up in your mind that you need to save your uterus. For your own well-being, preserve your uterus. That is the mantra. Unless it is inevitable to have it removed for reasons of medical advice and beyond the realms of what your individual wish could be aware that there are many options in this scientific world which is advancing, and always ask for those options from your doctor, and I'm quite hopeful that each one of us standing here with the vision of your well-being will relate to your request and put our best foot forward to always do the best for you. With that, I would like to once again place on records our humble and sincere thanks on behalf of the IHW Council and the entire team, Mr. Kamal Narayan, who has been consistently and persistently working towards many of the social causes for the health and well-being of the generation next, if I may say. So Dr. Ashwath Kumar, Dr. Manoj Thomas, and Dr. Lalitambika. Last but not the least, he's almost a doctor now, Deepak Chopra, and the one who had already excused herself that she needs to go for another meeting early in Matthew. We sincerely thank all of you for giving such brilliant and insightful inputs, and also a very sincere intent that the journey is long, we need to do a lot more, and we resolve to do whatever it takes to do the best for the girls and women of this great country. Namaskar and thanks once again.
Thank you so much. Pleasure to have you. Thank you.
Thank you.